Welcome to Season 3, Episode 1 of the Home Healthcare Today show. I am your host, Dr. Cleamon Moorer.
And help welcome our honored, distinguished guest, the Reverend Dr. Martin Luther King.
We are observing the life and legacy of the late Dr. Martin Luther King Jr. in this special episode to kick off our third season, which is Season 3. All right. We are honored to have on our show today Mrs. Sheryl Garland. All right. Sheryl Garland is a native of Richmond, Virginia. She received an undergraduate degree from Wake Forest University in 1982 and a master's in health administration from Virginia Commonwealth University in 1988. Since joining VCU Health System in 1987, as an administrative resident, she served in various leadership roles, including Vice President for Health Policy and Community Relations, Vice President for Community Outreach, Director of Ambulatory Care Services, and Director of Planning. In her current role as Chief of Health Impact, Sheryl is responsible for building programs and partnerships to improve the health of populations and communities served by VCU Health System. In this position, she provides leadership for the health system's division of community health that focuses on advancing health equity and addressing health disparities for patients. Projects to date have included initiatives to identify and address social determinants of health, such as housing instability, food insecurity, employment and transportation needs. In addition to her health system responsibilities, Sheryl serves as the executive director of Virginia Commonwealth University's Office of Health Equity. Sheryl is the recipient of several awards, including the American College of Healthcare Executives Regents Early Career Healthcare Executive Award, the VCU Presidential Award for Community Multicultural Enrichment, the VCU MCV School of Medicine Dean's Award for Community Service, the YWCA of Richmond Outstanding Woman of the Year Award in the field of health science, the VCU Department of Health Administration Alumni of the Year, and the Lifetime Achievement Awards, the First African Baptist Church Community Leaders Award, and the MCV Foundation's Jerome F. Strauss III Award. She participated in Leadership Metro Richmond, the National Association for Public Hospitals and Health Systems, America's Essential Hospitals, Ambulatory Fellows Program, the Grace E. Harris Leadership Institute, and Lead Virginia. Sheryl is a fellow in the American College of Healthcare Executives and a member of Sister Fund, an African American women's giving circle. She currently serves on the Virginia Board of Social Services, as well as the boards of the MCV Foundation, Virginia City Center for Health Innovation, American Heart Association Mid-Atlantic Affiliate, the Community Foundation for Greater Richmond, and the Institute for Public Health Innovation as board chair. Sheryl is also a trustee emeritus of the Richmond Memorial Health Foundation. Sheryl Garland, welcome to our show today.
Thank you so much. I am so honored to be with you this morning, Cliff.
Thank you, Sheryl. Sheryl, with such an outstanding career and stellar background, and your continuous pursuit of closing gaps for health equity and access for people of color and for all people, considering your role at Virginia Commonwealth and your multiple roles across the state of Virginia, you are most fitting today to help us honor the legacy of Dr. King as related to his pursuit of health equity access for all. I want to refer to one of Dr. King's many quotes. One of his quotes in regards to healthcare. Dr. King once quoted, "Of all the forms of inequality, injustice in healthcare is the most shocking and the most inhumane." So, Sheryl, as we consider the life and legacy of Dr. King, how can we today best align the pursuit of equality and equity within civil rights or social justice with that of equitable and equal access to quality health care?
Well, Clem, first of all, thank you for starting with that quote from Dr. King. While
Yes, sir.
he said it so many years ago,
Yes.
it is so relevant to what is happening in America's healthcare system today. And there are many lessons from Dr. King's life and legacy that can be applied to the struggles to achieve equitable access to quality healthcare.
Yes.
Similar to the questions that were raised during the civil rights movement, we in this country continue to struggle with the issue of whether all should have equal access to healthcare services. Is it
Yes.
a right? Is it a privilege? To address this issue, we really need to deal with the inequities that have developed throughout our history, such
Yes.
as poor living conditions, inadequate access to healthcare providers, disparate access to health insurance. And if you go back and think about the definition of health equity, that is everyone has a fair and just opportunity to be as healthy as possible to achieve optimal health. Like the actions that were taken during the civil rights movement, if we're serious about achieving this goal, we
Yes.
must address the systems, the policies, the practices, and even the laws that are entrenched in our society that are preventing people from achieving optimal health.
Yes, ma'am. Yes, ma'am, Sheryl. Yes, Sheryl. And you mentioned, you noted very comprehensively there systems that have inputs, outputs, and they're processed to an extent. And we're talking about human services when we talk about health and access to it, policies, practices, and even laws. And then you honed in on all for everyone to be able to have access to optimal outcomes, optimal quality care. So when we think of everyone, we do understand, Sheryl, that there are groups and segments of the American population that unfortunately are at greater risk of issues and challenges as related to health, as related to some of those social determinants. So let's spend a little bit of time there. As we think about some social determinants, you mentioned transportation and we mentioned access, um, communities, employment levels, all of those factors play safety. All of those factors play into what is called a social determinant of a health outcome. When we think about Black and Indigenous individuals and people of color today in the United States compared to 1968, what are some of the greatest strides that we've seen? And also, what seems to be some of the greatest areas of improvement as we think over the last 55 years?
So let's start with the strides. We really
Yeah.
should celebrate the
Yes.
achievements that have been made in this country, such as availability of access to public programs that have been established to address issues such as housing needs and food assistance, programs
Yes.
like SNAP and WIC, and
Yes.
unemployment. And this was very important, especially in the early stages of the COVID pandemic, to be able to provide benefits to individuals who lost their means of living.
Yes.
And so I'm very proud of the steps that our country took to provide some protections to individuals, and especially an area around halting evictions and providing rental assistance. That being said, there remain multiple areas for improvement.
Yes.
It's sad to acknowledge that many of the issues that plagued communities of color and low-wealth individuals in the 1960s remain with us today.
Indeed.
We continue to see disparities in access to quality and affordable housing, gaps in the pay, especially for people of color, and economic challenges that are resulting in continuous food insecurity and lack of availability to transportation even. So these are things that we need to keep our eyes on. It's great that we can celebrate the social programs, but
Yeah.
we are not where we need to be yet.
Absolutely, Cheryl. Well, very well said. I like you started on the highest note of celebrating some of the strides and the accomplishments, but the glaring gaps, as most recently evidenced through COVID-19. Right, as we looked at the disparity of even access to vaccines for many populations in many communities, and then the research that we're able to do from academic settings where we're able to identify various zip codes and communities around the country that are at greater risk of lack lack of resources, lack of support, lack of funding. So yes, ma'am, we definitely sure have to do a much better job. So that leads us to a very big question here prior to our commercial, right? We've identified that there are some gaps that remain 55 years later. How do we close them? How do we close some of these gaps for BIPOC populations in the areas related to health access and perhaps create some more favorable outcomes? How do we make this a front of mind initiative? It needs to garner our attention. And how do we do this?
So let's start with something that's very fundamental, which
Yes.
is the impact of access to health insurance. I am not advocating that this country move towards socialized medicine or the forms of insurance that have even put into other industrialized countries around the world. However, the data does not lie. The outcomes speak volumes. And
Yes.
that is, we are one of the richest nations in the world, yet our health outcomes do not reflect the amount of money and the resources that is spent on an annual basis in providing health care.
True.
And disproportionately, we are seeing negative outcomes amongst people of color.
Yes.
The other is we really need to continue to focus on improving awareness and education regarding prevention and wellness activities, especially as it relates to chronic conditions that disproportionately impact Black and Brown communities, such as heart disease, diabetes, hypertension, that can all lead to premature death.
Yes.
These are very simple, basic public health tenets. Let's provide people with access, the means to gain access, and education around prevention and wellness activities.
Yeah. Great recipe there, Cheryl. Prior to our commercial, as the sponsor of the Home Health Care Today show, we here at American Advantage Home Care, we walk that walk every single day as we deal and manage patients' care and patients who suffer from a lot of those illnesses that you mentioned. And they get it on a discharge paper from the hospital. They get it via a diagnosis by sitting with their primary care physician. They find out, hey, I have hypertension. I have diabetes. I'm in stage 3 of kidney failure, kidney disease. And they're finding themselves trying to backtrack, how to live a healthier lifestyle, how to manage a chronic illness. But to your point at the end there about prevention and wellness, Very, very promising. Very promising as we begin to educate, as we begin to train, as we begin to reach, as well as give hope to those that do have a diagnosis, that the diagnosis is not the end, right? It is the
Agreed.
it's the beginning
Agreed.
to making better decisions and taking better steps if the access is there. Oh, wow. Cheryl, we're going to go to a quick commercial break and we're going to come back and talk more about the life and
Okay.
times of Dr. King as related to health equity and access and more about you. We'll be right back.
As Americans, we're defined by our grit, our toughness, our excellence, and our multiculturalism. But here in Detroit and Southeast Michigan, we are battle tested. That's our advantage. We've been hit rather hard by the pandemic and other health challenges. Allow American Advantage Home Care to provide skilled home care services for you in the comfort of your own home. We are Joint Commission accredited and CMS certified. Call us today.
Welcome back to season 3, episode 1 of the Home Health Care Today show. For those of you that are just joining this segment, we are having a very thorough conversation with Sheryl Garland, Chief of Health Impact at Virginia Commonwealth Health System and Executive Director for Virginia Commonwealth University's Office of Health Equity. And we are honoring the life and times of the great late Dr. Martin Luther King Jr. in this first episode of 2023. All right, Cheryl, let's pick up where we left off there, right? How do we currently see, current time 2023 here, how do we currently see the vision, the work, the contributions, and dream of Dr. King currently being realized in the healthcare space?
So that is a very interesting question.
Mhm.
Again, think about 50 plus years after Dr. King's passing, how were his teachings and the things that he stood for relevant? And I would start with there's a growing recognition of the social and economic injustices that Dr. King was so passionate about that continue to be drivers of the health inequities that exist today.
Yes.
And so the message is there's no time to rest because the struggle continues.
Yes,
And
ma'am.
we can utilize his teachings to guide the intentional development of solutions that focus on addressing the historical policies and the practices that have gotten us to this place in healthcare today. And by doing so, we can honor his legacy and address the injustices that are negatively impacting the health outcomes for poor and minority populations.
Yes, ma'am. Yes, indeed, Cheryl. And Cheryl, you embody it. You have been a champion of the legacy throughout your career. It's more than obvious in the introduction that we started with. You live this fight, you live this battle, and you pursue the merit of overcoming these struggles every day for folks throughout that Virginia Commonwealth University health system and beyond across the state. Are there some specific, right? So out of that illustrious background and all that you do, are there some specifics that come to mind for you personally and or professionally um, as you continue the legacy? And then how do you encourage others around you as a leader being responsible for so many personnel and touching so many lives? How do you encourage others to do the same throughout the healthcare space?
So thank you for asking that question.
Yes, ma'am.
Um, as a little Black girl growing up in the 60s
Yes.
in Richmond, Virginia, the former capital of the Confederacy,
Yes.
it
Yes.
was instilled in me by my parents and my grandparents that because of the work that was done during the civil rights movement, that
Yes.
opportunities were provided for me
Mm-hmm.
and they existed for me to take advantage of.
Yes.
I was taught at a very young age that if I encountered societal wrongs, even I could make a difference. And this was a bold teaching from a
Yes.
generation of parents and grandparents who had suffered and paid significant dues. And I think, in the words of that wonderful woman, Fannie Lou Hamer, they were sick and tired of being sick and tired.
Yes,
And
ma'am.
they wanted something better for the next generation. They really saw and they believed in the examples that were set by Dr. King and many other brave men and women who stood up for what was right
Yes.
during this era. So this hope has been a driver for me throughout my entire life, and especially as I begin my professional journey. It has led me to pursue justice for all people who
Yes.
just want a fair opportunity to receive access to healthcare. And this often means being placed in the uncomfortable position of addressing systemic issues, some of the historical policies, especially in an organization such as where I work, which is the largest safety net health system in the Commonwealth of Virginia, that
Yes.
has a very checkered past in its relationship with the communities that it has served, especially people of color.
Yes,
So,
ma'am.
what I would say to young people today is stand up, do not be afraid, but more importantly, spend some time really understanding our history and what has gotten us to this point,
Yes, ma'am.
because you will be emboldened
Mhm.
when you really step back and think about the sacrifices that have been made to allow us to sit on podcasts
Yes,
and to
ma'am.
be in public settings where we can stand up and be advocates for making significant changes for those who still need help.
Absolutely. Absolutely. Very, very well said, Cheryl. Um, and for those, last question there, for those young people, Cheryl, that will wonder, like, well, where do I start? Right? I may not be able to do all that you were able to accomplish, Miss Garland, or Dr. Moore, watching the Home Healthcare Today show. I might not be able to do all of that. But at the very least, where do I start? And as a young person, how can I continue Dr. King's legacy and perhaps, make them proud?
So thank you. I'm so glad you asked that question, because often
Yeah,
it's hard to just kind of sum things up and say
right.
to folks, what do I do? What do I do?
Right. What do I do?
So let me start by
Yes.
saying I really do worry
Yes.
that Dr. King's legacy has been condensed to sound bites of
Yes.
several of his popular speeches.
Yes, ma'am.
And I worry that we think about Dr. King on his birthday, on that
Yes.
federal holiday,
Yes,
and
ma'am.
during Black History Month. But his work was so much more important,
Yes.
and it really needs to be woven into what we do on a daily basis. I think it's important to recognize that even in the face of adversity and massive hatred,
Yes.
that Dr. King continued to speak truth to power. So I'm
Yes, he
speaking
did.
today's language now.
Truth.
He
Yes,
spoke
ma'am.
truth to power, and he stood up for what was right, even when it wasn't popular.
Yes.
I often think about the level of conviction that was required to live such a life of service and sacrifice. Now, am I advocating that everyone go down that path? No. But let's remember, he was a young preacher
Yes, he
coming
was.
out of the South who took significant risks, so much so that he gave his life for what he believed in.
Yes.
So I think it would be an injustice to the legacy of Dr. King and those who also worked beside him and with him, who sacrificed for my generation and those that have followed, if we do not at least attempt to engage in purpose-driven work.
Yes, ma'am.
There is too much work to be done to rest. Just take a look around. And we would be derelict if we just sat back and reaped the benefits of those who have come before us and not ask the question, what am I supposed to do?
Yes.
Where is it that I can serve? And so
Absolutely.
that is what I would leave
Yes,
with
ma'am.
your listeners.
Wonderful, Cheryl. That is the perfect way to end it. Encouraging others to carry the torch, which means to be bold. It means to be courageous, to be selfless to an extent. And to your final point about a purpose-driven life, working to improve the lives of others, speaking truth to power.
Yes.
Cheryl, you have been outstanding today.
Well, thank you.
Yes, we thoroughly appreciate your insights and pearls of wisdom there as we continue to honor and celebrate the life and times of Dr. King, past the federal holiday and past Black History Month, but each and every day looking to carry the torch and doing some good work in the world and living a purpose-driven life. Thank you so much for joining us today, Cheryl.
Thank you for having me.